got good strength in this back. She's using it really well. So everything's been going pretty good.
So I know the tail is something we discussed.
That's
in a few weeks or something.
We deal with that once we know how well she's recovering.
Yep.
So
That's not a big deal. I know that's probably going to come off, and we deal with that then.
as long as she's not getting it caught on anything.
Yeah. Then we look at doing it
Sooner.
Yes.
Because if she's going to cause some more trauma, we'll take us massively backwards. We're not that stuff.
And bring her head around between your knees.
Yeah, sure, that's fine. Come here, Lily.
Feel her back legs.
Come here. Good girl.
Good girl. So, do you know her well?
Reasonably well. Yeah.
When did she start looking odd in the back legs?
So she did start. She runs very well. Has full stride and is on her feet all day. But it probably would have been a couple of months ago that we started to see one of the legs isn't like in a straight line, like it wobbles as she pulls it back through to get another step. And that kind of has gotten a bit more pronounced in the last probably month or so. And that's why I originally wanted to get it checked out. Because if she's in pain or something like that, then we want to manage it.
The good news is that if it is what we think it is, it's not painful.
Yeah, that's what they said.
It's
yeah.
disabling.
Yeah.
Because the leg is
Limited movement.
Yeah, because literally a muscle's just turned to scar tissue.
Yeah, sure.
And it's contracting up.
Uh-huh.
And we used to try and cut these muscles out.
Right.
And the dogs look great for about a month or two, and then the problem comes back.
Right.
Because the area where you cut it out just forms a big strong band of
Yeah,
scar tissue.
sure.
How old is she? How old?
Yeah, I should know this. I think she's
Really?
4.
4.
Yeah.
Okay. What age have we got on her record?
But I actually thought she was here for her back, not her legs.
Okay.
So the legs is that tendon one that I think that they pretty much said there's nothing we can do for her and it's not painful. But there were 2 vertebrae in her back that looked like they were, I think the term they use, self-stabilizing. So like they'd fused together.
Yep.
So it was more along the lines of what the process or treatment or management strategy should be for that.
Does she seem painful up around here?
She does pant at rest at night. I can see her panting, which tells me she's in a bit of pain. But through the day, you would never know. She's
she
just
moves
full
around
on.
and
Yeah.
does stuff without-
She runs. She full sprints. She doesn't stop anytime I walk outside.
'Cause
She's with me.
we didn't get a copy of the X-rays, did we?
Not last night.
No. Because we might chase those up if you're in a
Yeah,
hurry.
I'm sure.
He described the abnormal X-rays in his notes.
Right.
The abnormal vertebrae.
Yeah.
But interestingly enough, German Shepherds often have weird-looking vertebrae,
Yeah. Okay.
particularly in this low lumbar area.
Yep.
But it does predispose them to problems, but don't necessarily mean they've got a problem.
Yeah, sure. And that's really what we were just here to find out, whether there's a major issue there. So as far as the legs go, she just will learn to... that'll be a normal run for her.
I need to find out a bit more.
Yeah.
Actually, when I saw she was coming, and I only realised this morning, I did a quick bit of reading, and surgery is no longer recommended for them. But they do talk about physiotherapy.
Uh-huh.
And I'm not sure how exactly what that entails and what we can achieve for you.
Yeah.
But I can find out.
Yeah, okay.
Because we've got physiotherapists here and
Yeah.
that sort of thing. And we need to have a think about what's the best practice for dealing with that problem.
Okay.
Now that we're pretty sure she's got it.
Yeah, sure.
And I need to find out about the vertebra.
Agra Green Cross is the referring vet with the x-rays. They did the...
Similar but different things happen in other breeds.
Yeah.
This is called the Gracilis muscle. I wrote it down for you.
Uh-huh.
And it is a German Shepherd.
Right.
And it's quite rare. I think I've been in business for 4 years. I've seen maybe 2 dogs per year.
Yeah, okay.
That's how unusual it is.
Yeah.
And that's one reason I wanted Ingrid to come and see it, because she's never seen one.
Yeah, sure.
She's been doing it for 15, 20 years.
Yeah.
It's very odd.
Mm.
But it's been around for a long time. You know, I have tried operating on them 20, 30 years ago.
Yeah.
And they look great for about a month.
Yeah, and then it just goes back.
And so it's a bit pointless doing the surgery.
Sure.
But at that stage, it was recommended to try doing the surgery.
Yeah.
But now, and I just had a quick look in the textbook before I came down, they
Yeah.
basically say don't bother, just
Yeah.
use physiotherapy.
Yeah.
But I need to talk to the physios about what they might be able to
What can they offer? Yeah. Yeah. Yeah, that's a greeting is always a similar greeting to vets, but then once we get in the here, she's fine.
I got the impression when you're walking up down the hall, the left leg was more affected than the right. Do you?
Yes. Yeah, I would agree with that.
Sadly, it's been both.
Yeah. Because originally it looked like it could have been a click, but it's just reaching its maximum extension and then lifting the leg.
It's a pity
Or turning
that
it.
it's not, frankly, a cruciate or something of the more common problems, because we've got better solutions here.
Yeah, right.
I've never seen it. I've been a vet for 20 years.
Yeah, you've never seen it?
Well, that's what I was just saying to Luke.
Yeah.
It's very weird. I reckon I've seen over 2 cases in the past.
Yeah.
And I have tried operating on them.
Yeah.
And they look terrific for about a month or 2. And then 3 or 4 months later, you go, no, it's just thank you.
Yeah.
And it's weird because you'd think if you cut out the muscle that was turned to scar tissue, it wouldn't come back. And you cut out the whole muscle.
Mm.
But where you've cut it out just forms another strong band of scar tissue that is almost identical to what you started.
Yeah, right.
You get like interest without this. That was arthritis surgery.
Yeah, but you just cut it.
Yeah.
You don't try and remove it. And it's not, it's sort of a different part of the muscle, I suppose. And see, if you just detach this down there, it's over a broader area. You know, it's not like a neat ligament, you just cut it. But we should do some research and just see what physio and or other things people have tried recently.
Mm.
Because there may be something new, but and the physio may be able to keep it loose with laser or something like that.
No idea what causes it?
No, it's obviously a genetic thing, but it's so random and unusual, no one's ever formed of. And I've never heard of anyone doing genetic testing on
Yeah.
to figure it out.
Yeah.
Yeah. Well, you probably, if you got half a dozen dogs, and that'd be an ask because no one sees half a dozen dogs in 10 years, you might be able to detect what's different about them. But it's a shame for her because it's going to disable her.
Yeah, right. So
Okay,
it's degenerative. It keeps going, gets worse and worse.
Yeah, well, and you know, and it may even get to the stage in 2 to 4 years that you're euthanizing because her hind leg function's so terrible.
Really? Does it spread through the body or just?
No, only affects the muscles in the caudal part of the thigh. It
So-
can affect other muscles other than the one it started in.
Yeah.
But it's only muscles in that area.
Okay. So then basically she's going to eventually lose the ability to push off her legs altogether because they're going to be restricted that much.
Yeah.
Right.
So it's a bad disease.
Yeah, okay.
And that's why I say we need to do some thinking about what we can offer you in terms of slowing it down or reversing it.
Yeah.
But my quick 10-minute research this morning didn't tell me anything.
Yeah, okay.
But we can put some more effort into that for you.
Yeah.
I might leave you here for 10 minutes.
Okay.
We'll try and chase up these x-rays
Yep.
and come back.
No problem. Well, that's not good news, Lily. Hey, darling.
But I didn't find anything helpful about treatment.
Right. So he has started the DNA process, so trying to figure out what's going on.
He's in Wisconsin, and he's an Australian guy who's been working there for years and years.
Okay.
But I could email him and just say, what have you found? But
Yeah.
it's probably not going to help her.
Yeah,
He
yeah.
may want blood from it,
Yeah, sure.
but I don't think it's going to help us
Yep.
treat her problem. There was one very brief mention that said stem cells may help. But stem cells get credited for helping all sorts of things, and
Yeah.
I'm not a strong believer.
Okay.
I'll do some more thinking about it though and ask around. Tomorrow we've got one lady who's a vet who's trained in rehab and in physio, and she will pull the lumbosacral joint. I'll just make it bigger. But this is that should not be there.
Yeah.
That's what the intervertebral joint should look like. But it's very common for middle-aged dogs to develop these bony bridges.
Right.
And they generally don't cause a problem.
Okay.
But certainly those two vertebrae are now basically fused together.
Yeah, sure.
But in fact, the main problem with that is it puts extra stress on the joints either side.
Either side, yeah. Okay.
Because now you've got a vertebra that moves together and doesn't have the flexibility. So there's extra stress on the ones either side. That said, you're not going to do anything about it unless she starts to get nerve damage or pain because of...
I wish my back would self-heal like that.
Well, sometimes they do.
Do they?
Yeah.
Well, I hope so. Avoid surgery.
And because often when they're doing surgery, they're fusing vertebra. Yeah. Because it's a loose one that's got discs and pressure on nerves that hurts. Yeah. But once they fuse, they generally become a non-problem. But it's not uncommon in older dogs to see all these fused together.
Right, okay.
And it's a bit unusual that she's got that change at her age, but it's a degenerative change that's probably not worrying her at all.
Okay.
So I'm not worried about that.
Not worried about that. What was the name of the condition she's got in her leg?
I'll write down for you.
Yeah.
Just get
Poor sweetheart.
I know where he got half a dozen cases from different places around the world.
Hello, Lily. Yeah, I kind of feel like we just have to forget about it for now and just live in the moment with her, because there's nothing we can do, and she's not in any pain, and she's still living a completely happy, normal life. But he said in a couple of years' time it's not going to be so great. But it's hard to really think about it. And you don't want to, for her sake, you don't want to feel sorry for her. She doesn't want us to feel sorry for her. Again, this is just another case of trying to give these guys the best possible life we can while we've got them. Because, their time is limited.
We got some not so great news about Lily.
Gracilis Muscle Contracture.
That's what it's called. So it's a really serious disease.
Very, very rare, but degenerative and ultimately completely debilitating as it goes on. So, yeah, pretty concerning. Don't want to think about it though, because she's fine now. She's not in any pain. It'll be a couple of years before it really starts to, be debilitating for her. At this stage, it's just a little funny gait in her leg. But yeah.
We just focus
for
on.
Sake, don't want to feel sorry for her.
No, we just want to focus on her living her best life and.
Chewing whatever sticks you want, hey Lil.
But we'll.
Yeah, she did a textbook
bark at the vet when he came out. So is this Lily?
And you know what? You can do it as much as you want, Lil.
You tell him, Lily.
Yeah.